Hey everyone, welcome to our channel. Today, we're diving into a serious topic: pancreatic cancer. It's a condition that doesn't always get the attention it deserves, but it's crucial we talk about it. The pancreas, it's a small organ, but it plays a huge role in our bodies. Pancreatic cancer is a tough one because early on, it might not show many signs, and when it does, they can be easy to brush off. That's why we're here today, to learn about the symptoms, so you know when to get checked out. Early detection can make a world of difference. So let's get right into it. One of the first signs of pancreatic cancer that can show up is jaundice. Now you might be thinking, jaundice, what's that? It's when your skin and the whites of your eyes take on this yellowish tint. It can even make your pee look darker. This happens when a tumor, that's the group of cancer cells, blocks the bile duct. The bile duct is like a little tube that carries bile from the liver and gallbladder to the small intestine to help with digestion. When the bile duct is blocked, bile builds up in the body, and that buildup is what causes the yellowing. So if you notice any unexplained yellowing, don't ignore it. It's always a good idea to talk to your doctor. We all want to lose a little weight sometimes, right? But when it happens out of the blue, without any changes in your diet or exercise routine, that's when you need to pay attention. If you're suddenly dropping pounds and you can't figure out why, it could be a sign of pancreatic cancer. You see, pancreatic cancer can mess with your metabolism and how your body digests food. This can lead to weight loss and feeling weak or tired. It's important to remember that unexplained weight loss isn't always a sign of cancer, but it's definitely something you shouldn't ignore. If you're experiencing this, especially if it's significant or happening quickly, please see your doctor. Our stomachs are pretty good at telling us when something's off, and abdominal pain is one of those signs you never want to ignore. When we're talking about pancreatic cancer, the pain often shows up in the upper abdomen, that area just below your ribs. It can also radiate to your back. Imagine a dull, persistent ache that just won't quit. That's what it can feel like. Sometimes the pain is worse after eating or when you're lying down. If you're experiencing this kind of pain, don't try to tough it out. Make an appointment with your doctor to get it checked out. Let's talk about those digestive woes no one likes to discuss: nausea, vomiting, and changes in bowel habits. It's normal to have an upset stomach every now and then, but when these issues become persistent or severe, it's time to take them seriously. Pancreatic cancer can interfere with the production of those digestive enzymes, the little helpers that break down our food. This can lead to indigestion, bloating, gas, diarrhea, or even constipation. If you notice any significant or unexplained changes in your digestion, especially if they last for more than a few days, don't just reach for over-the-counter remedies. Make an appointment with your doctor. We all have those days when we're just not that hungry. But if you're consistently losing your appetite or just don't feel like eating, it's worth paying attention to. Pancreatic cancer can affect your appetite in a couple of ways. First, as we talked about before, it can mess with your digestion, making you feel full quickly or nauseous after eating. Second, the cancer itself can release substances that interfere with your hunger signals. If you're experiencing a significant loss of appetite, especially if it's accompanied by unexplained weight loss, don't hesitate to reach out to your doctor. Diabetes is a condition that affects how your body regulates blood sugar. Now, developing diabetes, especially later in life, can sometimes be a sign of pancreatic cancer. The pancreas plays a vital role in producing insulin, a hormone that helps regulate blood sugar levels. When a tumor develops in the pancreas, it can affect insulin production, leading to a sudden increase in blood sugar and a diagnosis of diabetes. If you're experiencing symptoms of diabetes, such as increased thirst, frequent urination, unexplained weight loss, or blurred vision, it's essential to see your doctor right away. Now, this one might seem a little strange, but itchy skin, especially if it's severe and persistent, can be related to pancreatic cancer. Remember how we talked about jaundice and how it's caused by a buildup of bilirubin in the body? Well, that buildup can also irritate the skin, leading to itching. If you're experiencing unexplained itching, especially if it's accompanied by other symptoms like jaundice or changes in your stool or urine color, it's important to get checked out by your doctor. We all feel tired from time to time, but the fatigue associated with pancreatic cancer is different. It's a persistent, overwhelming tiredness that doesn't go away with rest. This type of fatigue can be caused by a number of factors, including the cancer itself, the body's immune response to the cancer, or even the treatments. If you're experiencing unusual or extreme fatigue, don't just brush it off as being overworked. Talk to your doctor. Here's a lesser-known fact about pancreatic cancer. It can increase your risk of blood clots. Blood clots are like clumps that form in your blood vessels. They can be dangerous because they can block blood flow to vital organs like your lungs, heart, or brain. If you experience symptoms like pain, swelling, warmth or redness in your legs, shortness of breath, chest pain, or sudden weakness or numbness on one side of your body, seek immediate medical attention. Now, this last one might seem a bit personal, but trust me, it's important. Changes in the color of your stool or urine can be a sign of pancreatic cancer, specifically when it comes to bile duct blockage. When the bile duct is blocked, it can cause your stool to become pale or clay-colored because the bile, which normally gives stool its brown color, can't reach the intestines. On the flip side, your urine might become darker, almost like tea, as bilirubin builds up in the bloodstream and is excreted in the urine. So pay attention to what's going on in the bathroom. Any unexplained changes in color, especially if they persist, warrant a conversation with your doctor. Pancreatic cancer is a serious disease, but knowledge is power. By being aware of the symptoms, you can take charge of your health. Remember, early detection is key when it comes to increasing the chances of successful treatment. If you experience any of the symptoms we've talked about, don't hesitate to reach out to your doctor. It's always better to be safe than sorry. And as always, thanks for watching.